Hello, Microhealth, and welcome back to Wellness Wednesdays. Joining us this week, we have a special guest, Matthew Blaisdell, who is actively practicing in nursing homes. He is with GAPS Health, treating geriatric patients. And this week, continuing off of our month of October theme, Dr. Blaisdell will be answering your questions about breast cancer, whether that is dealing with when people should be getting their exams done, the risk in men, and so forth. I just want to say thank you for taking the time to meet with us, and I am sure you are a busy guy, so MicroHealth really appreciates your time and the knowledge that you'll give us today. And without further ado, Doctor, would you like to give a brief explanation of your background, and then we can dive into the questions?
Sure. Well, thank you very much for having me. Again, my name is Matthew Blaisdell. I went to college at San Diego State University, got a degree in biology, then went to Touro University, California for medical school. Did family practice residency afterwards in Redding, California at Mercy Medical Center. And then, yes, I've been at GAPS Health most recently, seeing mostly geriatric patients in nursing homes, but I've done previous government work and seen patients of all ages and all different types of communities with all different types of problems. So pretty diverse background in training and where I've been practicing.
Yeah, that's great. It sounds like you have a good extent of knowledge. And for those of you listening, he knows Dr. David Clayton. So shout out to Dr. Clayton for getting us this connection. And yeah, if you guys have any questions too, you can always reach out to Dr. Clayton after this. Um, all right, so we'll go ahead and dive into the questions. So first one, what are some preventative measures people can take when it comes to decreasing their risk of breast cancer?
So in decreasing risk, there's, I'd say the biggest thing is mostly kind of work on your own personal health, right? There's some things that patients can't do or can't change, such as their genes or genetics. But things like obesity, smoking, tobacco use are all things that can decrease risk. Obesity being a big part or a big one. Adipose tissue or fat tissue. Fat cells actually do produce and secrete estrogen, right? So having extra adipose tissue or extra fat cells in your body can actually increase that estrogen and actually increase your risk for breast cancer. So being overweight or obese, if you work on your diet, exercise, get that reduced, you can actually reduce your risk for breast cancer. Things like tobacco and alcohol use, again, those are just things that can cause cancer in general, just causing as a toxin in the body, increasing inflammation and increasing your risk for cancer. So decreasing those, living a healthier life. Certain populations of people who work in, I guess, environments where there's high risk to radiation, you can see a higher risk in, again, all cancers, not just breast cancer, things like that.
Okay. Would you say that's also true, the things that you said, such as obesity and tobacco, are also usually pretty common for other types of cancers as well?
Absolutely correct.
Okay. Okay, we'll go on to the next question. So, what should someone be aware of when doing self breast exams? Should they be doing them? And where can people find the correct resources for how to do them?
So the biggest thing I would say is in regards to any question on any kind of cancer screening or healthcare maintenance is go see your primary care doctor at least once a year. And if you've got certain medical conditions, probably every 6 months, depending on what those could be. Uh, when I was in medical school and even in residency, there was recommendations for self breast exams. There currently actually isn't a recommendation for self breast exam. And the main thing for that is more recent studies have shown no improved outcome or no earlier of a diagnosis of breast cancer in women who have been performing those versus those who have not been performing those. Again, that's something I would have a conversation with your regular doctor on. You can have shared decision making. Previously, they would, tell women to perform those usually in the shower, and you're looking for hard lumps or masses in the breast or under your arm in the armpit, changes in appearance or fullness of the breast, any change or discharge from the nipple, things like that. But again, technically, that's as most recently, there's no there's no recommendation to be performing those. But again, I would see your regular doctor and discuss those.
Okay, yeah, that's pretty interesting. I had not heard that, so that's good information. I guess it also makes sense because you had recently done your residency, so you have all the recent information. Um, for people who are wanting to get more of like for I don't know, someone who's, not a doctor, just a general person, how can they find the most up-to-date information on things like that? Like how could we have known that maybe we shouldn't be doing this and we should be doing
So,
something else instead?
so I guess that's the problem with the internet is there's so many things out there. The big ones you can look for are the ACS or American Cancer Society. They've got recommendations. There's also the USPSTF or United States Preventative Services Task Force. There's also, if you want to kind of go more into actual medical organizations, you can look at ACOG, the American College of Obstetrics and Gynecologists, for their recommendations as well. They all actually kind of differ in their recommendations for who should get breast cancer screening and when. There is some overlap, but some of the things they change and who should get screening and when. They're very similar though, but again, the thing I would harp on the most is go see your primary care doctor so you can discuss, hey, you know, when should I get this done and what's your opinion, since there's so much information out there.
Okay. And I guess it probably depends on if it runs in your family, you're probably going to want to get it more than if it doesn't, and they'll
Yes,
know that.
absolutely. Yeah.
Okay. Okay. We can talk about that, yeah, a little bit later on. Actually, right now. So, yeah, going off of genetics, what role does that play in somebody, their risk of getting breast cancer?
So genetics is huge. That's like we spoke earlier. That's the thing that people can't change. So I'd say, yeah, there's mild, medium, and then high risk for breast cancer, right? The average woman is, I think, a little bit less than 15% chance of getting breast cancer in their lifetime, right? So that's about average risk,
Mhm.
um, right? And then being like a moderate risk, about 15 to 20%. That's, say, a woman with like a first degree relative who had breast cancer, right? So you're increasing maybe 5%. And then high risk is any woman who's had maybe other types of cancers like ovarian cancer. There's peritoneal and tubal cancers, things like that, or a family history of other cancers, or a strong family history of breast cancer. So maybe more than just one first degree relative with breast cancer.
Mhm.
And again, that's something you can talk with your primary care doctor, who can maybe refer you to a specialist, and they do have genetic testing looking for those genes. And there are the big genes that are out there. Maybe some of the listeners have heard of the BRCA or BRCA1, BRCA2 genes. Those are things they can look for if you have a family history of breast cancer or other types of cancers.
Okay. So how come this cancer is so like I feel like they really emphasize genetics plays a huge role in if you get breast cancer and it's not as emphasized in other cancers. Is that maybe something I just
It I would say the big thing for that is you see such a high increase, right? So you can see over like and I don't have the exact percentage, but it's definitely more than in the 1 in 5 for the high risk, right? So
Mhm.
it's such a high risk of getting it. Um, it it's really one of those things that they've shown genetics for, versus like lung cancer. It's very rare to get lung cancer unless you've smoked cigarettes. There is a type of lung cancer that you do see in people who didn't smoke, but otherwise we really only screen for lung cancer in those people who have smoked. And then
Mhm.
again, and things like colon cancer, you can see a really high prevalence of the people who get it are. I mean, everyone should be screened for colon cancer at a certain age, but you see a higher percentage in people who had certain diets. There's kind of fun fact when you look at different parts of the world in regards to GI cancers or gastrointestinal cancers, based off their diet, you see cancers in the stomach versus cancers in the colon based on their diet. It's kind of interesting. But for
Mhm.
breast cancer, at least, it really is that genetic component. And we talked earlier about lifestyle changes, where you can see higher higher percent of breast cancer in women who have who are maybe like obese. You see higher in obese women. You see higher in women who smoke or use tobacco. You see higher in women who may have started menses earlier than other women. But again, the genetics is what is really causing that change between
Okay.
the medium and the moderate and high risk.
Okay, that makes sense. Do you see now, I don't know how much knowledge you have on this because I'm guessing it's very specialized, but do you know of birth control and like since that's been introduced, if that has any increased risk for breast cancer for people?
It's from again the what I learned in my schooling and the training I got was it not a noticeable that would change anything in the screening or who would be considered mild, moderate, or high risk, or who would be screened differently than a normal at risk female.
Okay. Okay, that makes sense. All right, so going on to screenings, how often should somebody get them? And then kind of what's the regular procedure for that? I'm guessing it does depend on the person and it does depend on what your doctor would like you to do, but do you have any recommendations for people?
Yeah, so again, I would absolutely number one say go see your primary care doctor to go, review this with them and go through your whole history, your whole social history, medical history, family history, everything. Uh, and again, like I said earlier, the ACS, the USPSTF, and ACOG, a lot of these overlap, but some of them are different. But
Mhm.
for the normal at risk woman, you under the age of 40, it's usually no screening is needed at that time. It's where it kind of blurs between ages 40 and 49. Um, and that's really where you have a discussion with your doctor about, hey, am I okay having a mammogram every year, every 2 years, knowing that there might be an increase false positives, or discuss with your doctor if you're okay with that. You can definitely start doing breast cancer screening at that time. Usually, I think between most organizations, it's recommended at 50 years old up to like 74. Every year, every 2 years, having a mammogram is pretty standard. After 75 years old, it really depends on life expectancy and kind of treatment goals at that time. Um, with the moderate risk women, with the first degree relative, they actually usually follow the kind of mild at normal at risk uh, women screening. But again, you could probably start earlier, right? So like if you do have a first degree relative, you can look at doing that genetic screening, look at starting mammograms at 40 or earlier if you're high risk or if you're concerned based off of what that family member, when they got their cancer, how severe it was.
Mhm.
If they got it post or pre-menopausal, things like that. Those are all kind of things you can have a discussion with your doctor or a specialist your doctor refers you to.
Okay. All right, genetics, genetics, genetics. I keep that in
Yeah.
mind and talk with your doctor.
Yes, absolutely.
Okay. Okay, awesome. And then going off of that, so talking about men, should they be going in and getting screenings? What is the pattern for that?
So it's actually not recommended for men to do it at all.
Okay.
There are male patients who are on hormone therapy. So any individual who may be on estrogen, if they're on estrogen for at least 5 years, again, this is something they would again discuss with their doctor or endocrinologist. Having increased estrogen can cause an increased risk of breast cancer. So in those patients, you would have screening, and again, likely starting at age 50. Uh, but that would be a unique circumstance. And as I said earlier, though, with things that increase estrogen in the body, like obesity, that's usually not enough. It has to be usually hormone therapy, which is where you would see actual recommendation for getting like a mammogram every year, 2 years, starting at age 50.
Okay. Awesome. All right, good to know. Is there anything else you would like to add for those listening? Something I didn't ask that you think is important?
Well, I know we just, yeah, we're at the tail end of October.
Mhm.
while recording this, and it's Breast Cancer Awareness Month. But again, there's so many other cancers out there that affect both men and women. Like I think we touched a little bit on lung cancer, colon cancer. Those are huge. Any individual who has had a smoking history should definitely talk to their doctor, because there are guidelines on who should get a yearly chest scan for lung cancer screening, colon cancer screening. That actually just changed recently. It used to be age 50. It was recommended to get a colonoscopy. It's now 45. And again, that's in average risk. If it's high risk, that's definitely different. And then we definitely heard about vaccines with COVID and getting the yearly flu, but most people don't realize that they're actually not up to date on their other vaccines. There's plenty of other vaccines that people might not be up to date on. There's hepatitis, meningococcal, MMR, Tdap, varicella, zoster, pneumonia. Even recently, HPV has changed. That used to be a vaccine that was only given to adolescent girls. It's now given to men and women up to the age of 45. How these things have changed in the last few years, just in my training and being out of training, is actually it's quite interesting to honestly see. So go get your yearly doctor visit and say, hey, what's new? What's changed? What do I need to do? What do I need to know? And there's all sorts of things they can, people can talk about with their doctor and kind of get up to date on.
Okay. Yeah, I love that. That's a good plug for us too, because at MicroHealth, we have the preventative care screening, which the employees know about, and you get 8 hours of paid time off. You get to go to 2 visits, 4 hours each, and you get some MicroHealth money too, $50 worth of MicroHealth money. So that'd be great. Yeah. And this is just a friendly reminder to go get it done. But thank you for your time. I learned a lot. This is great for me. I'm in my upper 20s, so good reminder for me in a couple years, like 10-15 years, to make sure I start really paying attention to these things. And I'm sure everyone at MicroHealth really appreciates the value and the content that you've provided today. So really appreciate it. Also, for those that do want to donate, I know that it is the end of October. It will be November 2nd when we post this, but you obviously can still go and donate. National Breast Cancer Foundation, as well as other cancer foundations that you want to support. I can't remember. Do you know what the cancer awareness is for November, Dr. Blaisdell?
To tell you the truth, I don't know.
I can't remember. Yeah, I don't remember. I'll look it up. I'll put it in the notes so you guys can go to the links. But yeah, thank you for everything and appreciate your time.
Yeah, thank you for having me. It was nice meeting you.